Namaste friends, welcome to ECG Masterclass by ICU with Dr. Bhautik. ECG is one of the most commonly used investigation in the medicine, whether you are in the ICU, emergency department, OT, wards, clinics. ICU interpretation is essential skill for in our department. Many students find ECG difficult because they try to memorize the pattern without understanding the basics. Today, we will build the strong foundation on the ECG. By the end of this lecture, you will understand cardiac conduction system, ECG paper, P wave, PR interval, QRS complex, ST segment, T wave, ECG leads, and systemic approach to the ECG. So now let's start with ECG. ECG stand for electrocardiogram. It is graphical recording of the electrical activity of the heart. Remember, ECG records electricity, not mechanical contraction. Electrical activity occurs first, mechanical contraction occurs later. So ECG tells us what the electrical system of the heart is doing. First, cardiac conduction system. To understand the ECG, we first understand the heart electrical wiring, the SA node, located in the right atrium, known as a natural pacemaker. Normal firing rate 60 to 100 beats per minute. Every heartbeat starts here only. Now come to the atrial depolarization. Electrical impulse spreads through the both atria. This produces the P wave. Really? Now come to the AV node, located near the tricuspid valve. Its job is to slow down the impulse. Why? To allow the ventricle enough time to fill with the blood. This physiological delay is represented by the PR interval. Okay. Now come to the bundle of his. After the AV node, impulse enter the bundle of his. Right and left bundle branches. The left bundle branch further divide into fascicles. Come to the Purkinje fibers. Okay. This rapidly distributed electrical impulse throughout the ventricles. This result in ventricular depolarization, which appears as QRS complex. Okay. The P wave represents the arterial depolarization. Normal duration is 0.12 seconds. Okay. Now come the ECG components we are discussing about. Okay. The P wave normal duration is 0.12 seconds. Normal appearance is small, smooth, upright, and in the most of the leads, easy trick P for pump preparation. Atria prepare the blood for the ventricles. Now come to the PR interval. Okay. Measure from beginning of the P wave to the end of the beginning of the QRS complex. Represent the AV nodal conduction time. Normally 0.1 to 0.2 second. 3 to 5 small squares. If prolonged, think of AV blocks. Now come to the QRS complex. It's represent ventricular depolarization. This is the most important waveform. Normal duration is less than 0.12 second, less than 3 small squares. White QRS suggests of bundle branch block, ventricular rhythm, hyperkalemia, and drug toxicity. Now come to the ST segment. Okay, ST segment is measured from the end of the QRS to the beginning of the T wave. It's almost a flat, called isoelectric point. Elevation and depression suggest of myocardial ischemia or infarction. Now come to the T wave, represent the ventricular depolarization, usually smooth and upright. Abnormal T wave may indicate the ischemia, hyperkalemia, and hypokalemia. Now come to the QT interval. Measure from start of the QRS to the end of the T wave represent the total ventricular electrical activity. Normal correlates the QT interval. Okay, in the man it is less than 450 millisecond, in the woman is less than 460 millisecond. Prolong the QT can cause torsades point. Now come to the ECG paper. Before interpreting the ECG, we must understand the paper. One small square is equal to 1 mm is represent the 0.04 second. One large square is equal to 5 small square represent the 0.2 second, and the 5 large square is equal to 1 second. In the standard ECG settings, the speed is 25 mm per second, calibration is 10 mm is equal to 1 millivolt, यानी कि जो 1 small square equal to 0.1 millivolt, 1 big square is equal to 0.5 millivolt, and 2 big square is equal to 1 millivolt. Always check calibration first. Now come to the ECG leads. Many students fear the leads. Keep it simple. Come to the limb leads 1, 2 and 3. These are the bipolar leads. Okay. Now come to the augmented leads. It's unipolar leads AVR, AVL and AVF. Now come to the chest leads V1 to V6. This provides the horizontal plane information. Think like different camera angles of the same heart. No leads is more important than another. Each give the unique view. Okay. So now come to the normal ECG values. What are the normal ECG values? Like heart rate 60 to 100 per minute, P wave less than 0.12 seconds, PR interval 0.12 to 0.2 seconds, and QRS 0.12 seconds. QT 440 millisecond in males and 460 less than 460 millisecond in female. X is -32 plus 90. Now come to the step-by-step approach. Now 6-step approach in the stepwise approach to understand the ECG. First of all, we have to calculate the rate. Then come to the rhythm. Then come to the axis. Then come to the interval PR, QRS, QT. Then come to the 5th step is hypertrophy, atrial or ventricular enlargement is there or not. Then 6th step is check for the ischemia and injury, ST segment or T wave changes. Never jump directly to the HDMI, always follow the sequence. What are the common mistakes they are doing? They're not checking the calibration, ignoring the lead placement, okay, skipping the step analysis, not measuring the interval, looking only at the one lead, ignoring the clinical concept. Okay, remember slow is smooth and smooth is fast. Then come to the take home message is SA node start every heartbeat, P wave is atrial depolarization, PR interval is AV conduction, AV node conduction, QRS is ventricular depolarization, T wave ventricular depolarization. Always check the ECG paper setting and follow the systemic intervention interpretation methods. Okay, ECG is not difficult. It is become easy when you understand the conduction system first. In the next lecture, we will learn the 5-step ECG interpretation method: rate, rhythm, axis, and interval. Thank you. I am Dr. Bhautik. See you in the next ECG masterclass. Thank you.